What do you do if your child or clients suddenly freak out when it's time to brush their teeth or get a bath, or they suddenly hate something they once tolerated or even liked? Today, we are covering how to pair or repair any activity and have better behavior. Hi, I'm Dr. Mary Barbera, autism mom, registered nurse, behavior analyst, and bestselling author. Each week, I provide you with some of my ideas about turning autism or signs of autism around. So if you haven't subscribed to my YouTube channel, you can do that now. So this week, we are sharing a small excerpt from podcast number 196. Michelle C. is back on the podcast for the third time. She is actually one of my online Facebook advisors and coaches within my online course now. But she started out as an overwhelmed mom during COVID and really had her daughter make complete turnaround. So it's always great to talk to Michelle C. And she has some really great advice in terms of desensitization and pairing and repairing any task, activity, toy, you name it. We cover it. Let's watch. I remember I asked you, did Elena have a medical procedure or something happen in the bathtub? But a medical procedure, which you would think, like, did she have to be held down for stitches or for a blood draw or something? You'd be surprised how many times that it's something not in the bathroom that derails something like bath time. And there was a procedure or an MRI or something, right?
There was. And I was so obsessed over, conditions in the bathroom. I was like, oh my gosh, like, was the water too hot? Did I ever put her in like scalding water on accident? I always did the elbow check. Like if it's an acceptable temperature for my elbow, it's an acceptable temperature for my kid. Right. So it wasn't the water. I was just obsessing over what's in the bathroom. I'm like, what is it in here that she doesn't like? Did I buy any new toys that are scaring her? What is it? But then you mentioned medical procedures, and she had two medical procedures very recently. And one of them was an audiology test. So for speech therapy, they periodically require, at least in my area, they require you to get a hearing test. So she had to get one of those, and it was just like terrifying to her. She didn't like being in a room separate from me. And they kind of they told me what they were going to do, and I didn't like it, but this procedure had to get done. So they held her head, and they, put the otoscope in her ear. I believe that's what it's called. And so they put it in her ear, and she just screamed. And because it was a stranger touching her, she didn't understand really why she had to do it. And I mean, she had language at this point, but her anxiety levels were just through the roof. So there was that. And then she also had to receive anesthesia for an MRI, because when she was diagnosed with autism, we put ourselves on a wait list for a couple of different medical procedures just to see what was going on with her, make sure we were ruling out other medical conditions at the time. So the MRI and the audiology test were done just before she started being terrified of the tub. And I remember you said that, and I thought, what would that have anything to do with it? And it actually had everything to do with it.
Yeah. So, if you think like they're touching her head, it's pretty similar to head washing. And it's amazing how a medical procedure could ruin haircuts. It can ruin picture taking, like just keeping the child still and positioning them. I mean, it's amazing how it can really have an effect on everything. So that was it. And Rachel was on the show fairly recently, a couple of months ago. We can link that in the show notes. And she has a typical son, Everett. And so all of these procedures work for typically developing kids on the spectrum. These are just general procedures that work no matter what. But she, toothbrushing got unpaired, because somebody else put Everett to bed, like her sister came over and put him to bed, didn't know the routine, or maybe pushed toothbrushing too much, or anyway, toothbrushing got unpaired. So the other thing about the bath is I would look at, did you go out, for the weekend and somebody else do the bath time routine? Did your husband try to give you a break by doing the bath and then did it out of order, or, did something that she didn't like? And that was a common issue for Cody, is that, they wanted to alternate who was giving the bath. But if you're having a problem, like a freak out, it's really best for one person to take charge, at least until it gets repaired. And then for both parents to kind of get together and say, okay, this is the way bath time goes in this order. And this, we count when we wash hair, like just all those little things that you may be doing. But in this case, it did seem to be triggered by the medical thing. But in actuality, okay, we figured that out, which doesn't have a big effect. It's like, now what do we do? And so I remember we gave you some advice, like we're not able to, even if you join the course and join the group, we're not able to go like exactly do this, but we're able to say, generally you have to repair the bathtub, which you have to go all the way back. And on page 210 of my book, we actually list the steps that, Michelle actually did from our basic information. Like I said, or somebody said, you might have to start with the child out of the bathtub, fully clothed, playing with toys inside the bathroom with water. And so you formulated your own plan based on Elena's situation and what she was going to tolerate. So why don't you just tell us quickly what you basically did?
Yeah. So it was very similar to what you just said. It was a process. It took probably a couple weeks, I would say, for her to be fully in the tub again, happily. But it was definitely worth the patience, and it was worth the effort. And really, it's not. I don't want anyone to think that this is like an overwhelming process. It's very simple steps. You just have to think about what your child is willing to tolerate and end on a good note every single time, without crying. And that's the goal. So for Elena, I would just keep her in her clothes and I let her step in the tub and play with her toys in the tub. No water. Nothing. She just played with her toys and she sat in the tub and she rolled her little cars around, and we would do that in there. And she loved that because she's very much a quality time love language kid. That's why table time works so well for us. I feel like that's why her language exploded when it did. On top of her natural abilities, of course, the Turn Autism Around approach is just so wonderful for quality time. But anyway, so she would just play in the tub with her toys. And then the next day I, cause she liked that. So the next day I put a little bit of water, like an inch or two of water in there. And I let her stand outside of the tub and play with water toys in the tub. And this was a long time ago, so I might have missed something that I actually have in the book, but this is like the general gist of it. So she did that. And then the next day, I had her wear just a diaper, and she got in the tub with just a couple inches, like a little bit of water. And she got in and she played with her toys while standing in the tub in the water. And then, the next day, this is when I started getting problem behaviors. It wasn't an absolutely perfect process, as was stated in the book. I didn't do this perfectly, and you don't have to do anything perfectly to get progress.
It's like a dance, and
yeah,
nobody, whether you have a BCBA standing right there, it's still a dance. Whether you have, a list of desensitization, you're going to have to push it enough to keep any problem behaviors at bay. If you get a little whining, you pushed a little too far, but you don't want to take it back down right that second. So it is a real big dance. And we do have the actual steps, and the steps are going to be different for Elena versus Johnny versus whatever. Some kids we put in bathing suits and then they can play in the water. You're eventually going to have to get back to hair washing and again, doing that as quickly as possible, but keeping the problem behaviors at bay. Hopefully you enjoyed that excerpt from podcast 196. If you did, I'd love a thumbs up, comment, share it with somebody who might benefit. And for more information about how you might become a member of our online course and community, attend a free workshop at marybarbera.com/workshops. And I'll see you right here next time.